back to Conversations with AcroPsych, where we create educational and inspiring dialogue around psychiatry and addiction. I'm your host, Dr. Matt Campbell, and today I'm joined by Patricia Alvarado. Patricia is a licensed professional clinical counselor in California, a licensed mental health counselor in New York, and the founder of Alvarado Therapy. Alvarado Therapy is a group practice that provides various forms of therapy, including EMDR, most commonly used for trauma, but a big part of what we really want to talk about today. So Patricia, welcome to the show.
Oh, hello. Thanks for having me.
Do you mind giving a little bit of summary of what EMDR is?
Yeah, so EMDR stands for eye movement desensitization and reprocessing. And basically, what it is that we use rapid eye movement or some type of bilateral stimulation to help reprocess trauma, help reprocess negative beliefs that we have about ourselves that unfortunately many of us live with. These are beliefs that they're not really things that we outwardly say out in the world. We're not typically going out saying things like I'm defective or I should be discarded, something like that. EMDR gets to the core of the things that really impact the way that we live our lives. The reason why we do the back and forth bilateral stimulation or rapid eye movement is because right brain is usually the emotional side when we are excited and happy and joyful and sad. Typically, it's also the part of our brain that is kind of online when we're even in the womb. Things that we hear from our mother or our loved ones are things that we automatically already start kind of like experiencing kind of before Earth's side, so to speak. Left brain is more of the logical when we say things like, damn, I should have done something differently, or I shouldn't have said this, or should have said that. It's also the part of our brain that really doesn't go online, so to speak, until like age 3 or so, when we start kind of learning the right from wrong, the good from bad, etc. The idea is that when we do rapid eye movement, we're able to say, yes, I feel hurt. Yes, I feel sad. Yes, this was really upsetting and I can also be okay. And when you're able to do that, acknowledge the things that have happened and also realize the power that you have right now, people are able to feel a lot better about themselves, a lot more empowered and be able to notice like, yes, these things have happened. It's really unfortunate. This is the way that my life has been, that these are the experiences that I have lived in or lived with. But right now I am okay. And that right now I am okay is what we really lean into as much as possible. Looking at the glass half full instead of the glass half empty. And that can really be empowering for people and really kind of shift the way that they see things. And that's kind of like in a nutshell, I guess you can say the power that EMDR has.
As you're describing it, it kind of reminds me when I first learned of DBT therapy, and they talk about that kind of emotional mind versus that rational mind, and that
Yes.
a lot of times we live in one side or the other, but it's that synthesis and being able to bring both into a present state that really helps people make the best decisions in that moment.
Exactly, exactly. It's acknowledging the past, but also recognizing the power that you have right now. In the EMDR world, we call it brain therapy versus talk therapy because it's less talking and more what do you notice? What do you notice happening in your body? What thoughts are coming up based on this past experience that you've had? And we go down kind of like the rabbit hole, so to speak, of all the different moments that they have felt, the person has felt the same way and they're able to kind of make connections on how like wow, I didn't realize that this experience of like 10 years old is still impacting me right now that I'm 30.
I will admit EMDR is something that I'm learning a lot more with speaking to you today. Some things I do remember reading at some point was the way in which it tries to simulate REM sleep. And I know I've read plenty about how sleep is really important in all of our medical and physical health and maintaining that, but also the emotional and psychological health as well. Is there any connection to how that's supposed to or how that connects to REM eye movements?
Yeah, yeah, actually. So, as you know, like when we are in our REM sleep cycle, some people that like kind of sleep with their eyes a little open, if you look closely, you'll be able to see their eyes moving very, very quickly. And that's basically what we try to replicate via the rapid eye movement. Rapid eye movement specifically, but any type of bilateral stimulation because we're going fast. So it's not a slow back and forth. It's very, very quick because we're activating right and left brain at the same time. And during REM sleep cycle, this is when you're dreaming where your subconscious kind of like comes up to the surface, so to speak. And that's basically what we're trying to do with this bilateral stimulation. Bring those memories that are living in your subconscious up to the surface because these are the things that most likely are impacting your day-to-day life. When I work with people and they are struggling with, let's just say like addiction, for example. And right now, the current stressor is that they have a really hard time with a substance and it's really challenging for them to leave it and they feel really guilty about themselves. Fair. That's what's happening. That's what's been happening. But what I want to understand is, how is this impacting you today? Like, I get it. This has been happening for several years, but how has your addiction been impacting you today? Well, they might say, well, I can't hold a job. And so now I don't have any money and I'm at the verge of being homeless, for example. And then I'll ask, well, if you are homeless, what does that say about you as a person? Well, it says that I'm a failure, I'm not good enough, I'm incompetent in some way. And then I start exploring, when is another moment in your life when you have felt that way before? We now do float back on different memories where the person has experienced a similar situation and living in that subconscious. We're able to identify moments where they have felt like a failure in the past. And it dates back to like childhood. It's usually been living with them for several years. When we start identifying these memories and then we start pairing it with the rapid eye movement, people are able to notice that this one memory brings them down into several different memories and different moments in their life when they have felt something very similar. So while we can start with like the addiction and like the potential losing a job, we might end up in like a time when, my parent abandoned me and I didn't know where they went for several months. And this all is living within us. And rapid eye movement, any type of tapping, fast tapping on your body, where it's right and left side, even like walking fast, paying attention to your steps can activate that like kind of like thing that we're looking for to go down into the neural network to help you reprocess the situation that we're working with.
I have a lot of patients, in one particular who is interested in EMDR. If we're starting from that framework, someone with PTSD, if she was going to you and she's trying to figure out, well, if I do go see an EMDR therapist, it is something that not everyone's heard of. What would that process look like? Can you explain, like, from a timeline, how much time am I investing? What does the actual session look like working with you? What could I expect from like outcomes, benefits that I would see along the way over months, over years? Like what would that really look like if I went to go work with you?
Well, I will say that the most common question that I get is, how long do I need to take this? How long do I need
Yeah.
to do this? And I'm just like, I wish I knew. When we kind of like open up the can of worms, so many things can come up, things that we didn't expect would be coming up. And so while one person might say like, yeah, I just want to, kind of work on this one thing, we might find ourselves working on all these other things that just naturally come up to the surface. But to kind of give like an idea of what, sessions even look like. The first thing that I always tell everybody is that we're not going to run a marathon without training. And I'm a runner, so I always use that kind of like analogy. But what that means is that in the first session, you're not going to be doing any type of rapid eye movement. And it's mainly for safety, so that you feel comfortable and safe to be able to work through these big things that you've been living with for years and years and years. First session is always like an intake. I want to get to know you, get to know a little bit about your upbringing, family dynamics, the things you like to do for fun, getting to know you, which is kind of like typical in many like mental health practices. So getting to know you. Second and third session are typically focused on exploring very specific coping skills. In the EMDR world, we call them resources specific for EMDR. This is when we start developing some things that can help you begin to put things on the shelf when they're just kind of like roaming around within your life. We kind of like try to find ways so that you can create some space between the big feelings and yourself. Right around like the fourth session is when we create a treatment plan, so to speak. We call it in the EMDR world a target plan. What are the targets that we're going to be focusing on during our work together? And between the fourth and the fifth session is typically when I find myself doing rapid eye movement or some type of bilateral stimulation. I usually say to give EMDR like 2 to 3 months at the least. What is that, around like 6 to 10 sessions or so? Because the first like 4 sessions, the first month is really like a lot of prep work, prepping you for the bilateral stimulation. After we start getting into that, things start moving very quickly. And I have some people that after like 5 months are like, I feel good. And, see you later. And then other people that they'll stay a little bit longer, but we'll maybe do some EMDR, we'll maybe do some talk therapy. Maybe I'll see them every 3 weeks. Maybe I'll see them monthly. Maybe it's more like of a maintenance kind of session. It really just depends on what the client has been experiencing. The big difference between EMDR and like traditional talk therapy is that in talk therapy, you can be there for months and months and months. But with EMDR, probably not that long. Like if you're coming on a weekly basis, depending on what's happening, a length of time of the session, you might find that after 6 months, you're feeling a whole lot better. Most people that are doing EMDR, they're not in therapy for like a year. Not because it's a short-term therapy, but it's just so effective that people start feeling a lot better.
Which
Now,
is the
just
ideal. It's always
yeah,
great to hear when the outcome has been achieved and people can move on. And
yeah.
I know I see with medications that can be a big question, a big apprehension is if we get on something that's working, will I be able to kind of let go and go live my life, or am I stuck doing this maintenance? And it sounds like for EMDR, you do get a lot of people who they complete the course of treatment and then maybe there's an intermittent maintenance, but really they get to go move on and they don't necessarily need ongoing treatment forever.
Yeah, actually, I have a client that I'm not working with her anymore, unfortunately, but it's for good reasons. I started working with her probably like, I want to say maybe close to 2 years ago. And we did about a year of EMDR, kind of like on and off throughout the year. Like some sessions, it was we were doing EMDR, other sessions we were doing talk therapy. Sometimes we were bi-weekly, sometimes we were weekly. It just kind of depended. But for about a year, we were doing EMDR. And then I also offer this thing called an EMDR intensive. It's like a full day, like 6 hours of just straight EMDR. It shaves off like almost like 8 months to a year of therapy. It's pretty cool to see. She was like, you know what? I want to just kind of like get this over with. And so we actually did a 3-day intensive. So it was 18 hours of EMDR over the course of a weekend. Yeah. We were tired.
Both of you.
Both of us, yeah. But we did like a checkup, like maybe 2 weeks later, just to explore how are you doing? How are you feeling? And she was like, I feel so good about myself. Like, I feel like all of these thoughts and feelings that I had about myself it's not there anymore. And this was somebody that at one point she had to come twice a week. A lot of the things that she was experiencing was a lot of high stress, a lot of big emotions, really challenging to regulate her nervous system. And so that like kind of like 3-day intensive happened last May. I actually just saw her for a 1-day intensive 2 weeks ago. And I was telling her, and it's for a separate issue,
So this is
completely.
almost a year later.
Exactly. And that's what I told her. I was like, hey, listen, like, I have a feeling that maybe part of you is kind of feeling some emotions because we're working together again, even if it's just 1 day. And she was like, yeah, kind of, that's coming up. And I told her, hey, like, I want you to remember that the last time we saw each other was last May. And she was able to recognize her like having consistent therapy, not since last May. We did a 1-day intensive, 6 hours, and we were able to knock out all of these things that were on her mind related to future things that might be coming up. And we're supposed to have a check-in, I think, next week. I am going to imagine that it's going to be a good outcome.
That's so cool to see. It's just such a great thing when people kind of move on with their lives and they're at such a free place to do that. I'm more familiar with prolonged exposure. And from my experience of it and from some of what I've seen, we always describe there's this big hump at the beginning. This is where all of your symptoms get worse. It's really difficult. It's intense. And then, maybe a couple weeks after that, things start to get better. Do you see that kind of hump where it really does get worse at the beginning with EMDR, or is it in a different way that it seems to actually avoid that kind of challenge at the beginning?
It's different and it's different. And, every EMDR therapist does things differently. So I could only speak on the way that I was trained and the institute that I work with and, the way that we do these things in my practice. But my biggest piece is that I want people to be successful. And so the way that I have noticed we're able to be successful is when we are able to increase that window of tolerance. The window of tolerance is the things that we can tolerate where we feel calm, cool, and collected. Maybe it's not comfortable, but it's not uncomfortable. Maybe we're not happy and excited, but we're content. And so when we're able to expand that window of tolerance, people they start feeling better. They just feel like that sense of hope. And so the way that I do that with EMDR is that we don't always tackle the hardest thing, especially with complex trauma, which is the majority of my clients. If I were to give the choice to the client to tell them, "Hey, what do you want to work on today? What target out of these things that we've identified that are the hardest things that you've ever lived through, which one do you want to start with today?" I want to say that 100% of the people will say, I want to start with the hardest thing. When I did that, people were like, I don't want to do this anymore. They start dissociating, they start blocking, and they're just like, this is too much, too fast, and I don't want to do this. I realized that very early on in my EMDR career. And that's when I started suggesting, why don't we work on something that's a little easier? Maybe something that hasn't happened yet, but you fear is going to happen. Or maybe let's start by the thing that is currently going on right now to see if we can get some relief. My goal is to have the client get some relief so that when their window of tolerance is expanding as we're moving through the different targets, they start feeling motivated and excited because the things that were bothering them when they first came to therapy are not so troublesome anymore. Working through like these targets takes weeks, even months, but it's all worth it at the end, because the client is able to see that the things that were like at a 10 at the beginning are maybe like at a 6, 7. And that is huge when somebody's been living with PTSD and complex trauma the majority of their life.
I like how you view it as this window of tolerability. And I think a lot of times when I'm talking to people with trauma, how I will instinctively think about it is something has happened and we now see all of these potential dangers that we're facing in the world, whether it's associated with the trauma or it's even not associated with the trauma, but there's a way in which our body is now hyper aware of all these potential threats. And because of that, we're having this really intense reaction that makes it very hard to tolerate things that we otherwise would have thought were safe. What you're describing is like we're learning that this is now safe and we can tolerate more and more and more, and we have a bigger world that we get to live in.
Yes, yes. And typically, I like to start like in the future. Tell me about something that brings up that same belief of, say, the example from earlier, I'm a failure. And they might say, if I never work again, if I become homeless. That hasn't happened. And so I lean into that part of like, hey, this hasn't happened yet. So keep that in mind. This is something that you think could happen, but it hasn't happened yet. And because it hasn't happened yet, they're now able to say things like, well, if I were to lose my housing, I could do this, I could do that, I could go here, I could go there. Or maybe if I stop using, if I go from every day to make just every other day, that might make a huge difference. Like they start getting their own insights. The way that I describe it often is like they're like on a train, right? They're on a train and I'm just like watching the train pass by, monitoring that the train does not get derailed. Because if it gets derailed, then we need to do some things to kind of get them back on track. But their brain is doing all of the work. And it's really cool to see how we have the power within us. We have the answers within us. And it's about just bringing it up to the surface and remembering the true power and control that we actually have, even in moments of distress. That's what EMDR really helps with, to remind people that they have a lot more control, even when they believe that they're powerless.
Very uplifting kind of therapy. I've at least talked a lot about trauma and PTSD, and I think you've referenced that it may be more than PTSD. What other kind of uses do you find EMDR is helpful for in addition to PTSD, which I think is the more common thing that we think of?
Everything.
Everything.
Honestly, everything. Like, I'm an EMDR therapist, so anytime that's a new client comes to my practice that wants to work with us just for just therapy, they don't even know anything about EMDR, automatically I'm like, yep, perfect candidate. It works with anxiety, depression, phobias, substance use, eating disorders, nightmares, medical trauma, a chronic illness, anything really that that we struggle with, anything that brings up a negative belief about ourselves. EMDR can help. I will say this, EMDR is not going to cure like chronic illness, but it's going to help with the emotional fallout as a result of the chronic illness.
Would it be fair to say sometimes there's like an underpinning issue that, connects to depression, anxiety, substance use? Would it be fair to say that there's kind of like a core belief or a maladaptive core belief that someone has developed that can manifest as depression, substance use, PTSD, all of these different ways? And when that's present, that EMDR can be helpful in alleviating that kind of core belief?
Exactly. Exactly. So, for example, with substance use, EMDR is not going to stop the person from using substances. It's not. But EMDR will help with the effects, the reasons why it even happens. We're looking for what made you want to use in the first place? What brought you to that place? You were not born this way. This baby was born ready to explore the world and immediately was faced with these challenges. And so EMDR can't literally take something at like a substance out of a person's body, but it can help the person understand what was happening that now has led you to use substances. And in the situation with like a baby, that somebody can say like, well, I was born this way, quite literally, I was born and then I had, alcohol or fetal alcohol syndrome or drugs in my body. Now the target is related to mom. Okay, so what does it say about you that mom didn't protect you? What does it say about you that mom didn't care about the substances that mom was taking? What does it say about you? And how does that affect you in the way that you now live your life? Again, it's not going to stop a person from doing something, but more so, what is the effects of it? What is the emotional fallout because you've been using substances? It's like something that you enjoy, but is also a consequence. And so we also target that. Let's target the fact that you enjoy it, but also the consequences that it brings as a result of you enjoying something.
From what I've seen with substance use problems, there's always such a wide array of things that can be contributing to it and reinforcing it to keep people in that cycle. But it does seem like the people who do find this kind of other side on recovery, they've found like some sense of purpose and connections with other people that are sober in recovery, but they're kind of like these positive connections. And research will think of like the primary outcome or the secondary outcome. And so sometimes we're focused on what the primary outcome is, which from an addiction psychiatrist is that they're not using. But to me, a lot of the secondary outcomes that are probably more important to people is that they've found purpose in their life or they've found connections. And I'm wondering if that's, even if that's not the focus of the work, if you notice that that seems to be like a common secondary outcome that happens along the work.
Yes. On one side of when we are working through like these maladaptive experiences and these really challenging targets, that's all like the negative neural networks. But we also identify positive moments in their life. And we identify this positive belief. And that positive belief leans into something that's actually tangible about the person. So it will be something like, okay, client, how do you want to experience yourself? How do you want to imagine yourself, look at yourself? And they might say things like, I want to accept myself regardless of the situations that I've been in, regardless of the things that I've done in the past. And then I will ask them, what are moments in your life, recent moments, maybe the last year, the last couple of years, where that has been true? I decided to go to a meeting. I didn't talk to anybody, but I went. Perfect. What's another thing? I decided to enroll in school. Maybe I will sit next to somebody that maybe I can strike up a conversation with. I've done it before. And EMDR kind of gives that additional push of like, hey, you've done these things before. Don't forget, which helps aid in that connection, that secondary gain, I guess you can say.
I want to switch gears a little bit. We've been talking a lot about EMDR, and I realize and see it as kind of a unique type of therapy. It's different than a lot of what I at least was exposed to in residency. And I'm wondering what drove you and what helped you find EMDR as such a powerful treatment modality.
I think it was out of frustration that I found EMDR, to be honest. I've been a trauma therapist since the beginning. Those that are in the field of mental health, it's because we've experienced our own challenges with generational trauma or cycles of abuse, things that we've lived with throughout our lives. And so I naturally was like inclined to be a trauma therapist. I've worked with victims of crime. I've worked with intense mental health, 24-hour psychiatric hospitals. I've worked in the community where it was all trauma, sexual abuse, physical abuse, emotional neglect, etc. Time and time again, I felt so powerless and helpless at the end of a session. After like 50-ish minutes, we have to end the appointment. And it's like, see you next week. And the amount of frustration that I was feeling, the amount of powerlessness and pain that I was noticing within my clients that I was witnessing is what led me to EMDR. And I was looking for something. I'm like, something needs to be different because people being in pain, talking about trauma just isn't it. I found EMDR. I read about it. I read about the research and I was like, I think this is it. I went to the training skeptical. I was like, what is this? What are we going to do here? And the cool part about the training is that, they make you also do EMDR. Like,
Experience it.
yeah, it's like these practicums that you
What
have.
was it like experiencing that for the first time?
I was like, what is this? First of all, I was like, why am I crying? And then why do I just naturally feel better? It's confusing. And most times clients would tell me like, I feel like I was on a roller coaster. And then suddenly you like get to the end after the training and I started using it with people. I was like, this is what I've been looking for. Because EMDR has like a way of kind of like compartmentalizing things, so to speak. But I always tell people it is compartmentalizing a little bit, but knowing that you're going to open it up. It's just on the shelf waiting for us to continue working on until the next session. And so kind of putting it away, knowing they don't have to deal with it, because like I have it, so to speak. I got it. I got them. It's healing. Not having to tell your whole trauma history and trauma story is helpful. They don't have to relive those painful memories. They know what happened. I don't need to know. And them knowing that they don't have to tell me is also something that is really empowering for people.
That's really cool to hear. And I'm now thinking of all these people that are going to want to find an EMDR therapist. So if they were trying to find an EMDR therapist, how would they evaluate whether or not this is someone who has experienced, is trained, and is going to be able to help them?
So a really good resource just right off the bat is emdria.org. So emdria, EMDRIA.org, is the International Association of EMDR. And they have a full directory that has certified EMDR therapists and EMDR approved consultants, which is what I am. There you'll be able to find certified EMDR therapists that have gone through extensive training, that have done, tons of continuing education. You can look for EMDR and substance use, EMDR and PTSD, maybe a specific kind of PTSD. So you can do some searches within EMDRIA as a way to help.
We'll include a link on that. Where do you work with clients, and what's the best way for them to find you?
Yeah, so my website is alvaradotherapy.org, and I'm based out of Southern California. We do have an office in Pasadena, California, where we can also see clients in person. We're able to work with clients all over the state of California virtually, which is really cool even for EMDR, because we use a very specific platform where we can do the bilateral stimulation via the computer. Same results as if you were in person. I'm licensed in New York, so I could also work with people all over the state of New York. Not only do I work with clients that are interested in EMDR, but I also help provide consultation to therapists that are looking to have more guidance on their EMDR work that they are doing with clients.
Some great resources, great places to find well-trained EMDR therapists. We really appreciate Patricia Alvarado taking the time, joining us, and providing so much valuable information on EMDR. Please share this episode with any friends, family that can benefit from this knowledge, and we'll see you next time.
Thank you. Bye.
Thank you for listening to this episode of Conversations with AcroPsych. I'm your host, Dr. Matt Campbell, and I specialize in psychiatry and addictions. If you have questions about psychiatry or addictions, I host a regular Q&A for therapists, providers, and the general public. You can find more information about us at www.acropsych.com or on all major social media platforms at AcroPsych. We kindly ask you to subscribe to this channel on YouTube or rate us 5 stars on Spotify, since it helps expand our reach and inspire more of our audience.
This episode and all material is purely for general education and not personal medical advice. It does not establish a doctor-patient relationship, and we recommend you working with the appropriate physician or other healthcare provider before applying it to your situation.